Hi, it's the Nursing Professor. Welcome back to another episode of Fundamentals on Friday. Today we're going to talk about the blood transfusion. Blood transfusions are super duper important, and they require really detailed care. Do not delegate any of this to an unlicensed assisted personnel, all right? Because you need to be doing that frequent assessment to make sure that your patient is not having any adverse reaction. So first, why would we get a blood transfusion? Typically, it's for a person that either had surgery, had major blood loss, or they were in some sort of traumatic incident that resulted in blood loss. We also give it for those people who have severe anemia. They have a low H&H or hematocrit and hemoglobin. We have that lab value and we see that they are very low. People with blood disorders like sickle cell, leukemia, hemophilia, chronic diseases like kidney disease, people who are on dialysis frequently get blood transfusions, and those with low platelet counts that could result from a disease process or that they had chemotherapy. But any of our blood products, be it whole blood, red blood cells, platelets, plasma, any of those need to only be infused with normal saline, and we'll get back to that in a moment. So before we begin this blood transfusion, there are a few things we must do. We must make sure we have that right patient. So verify the patient, 2 RNs. You're going to look for their date of birth and that you have the correct person. So name and date of birth would be 2 identifiers, and you're going to check it against their ID band. All right. You're going to confirm their blood type and RH factor. Okay, so if it's A positive, should be A positive, those types of things. We're going to make sure that those match. We're going to check the expiration on the actual blood product to make sure that it is still good. Make sure we have a consent on file and explain the procedure to the patient. All right, so that's before we start any type of infusion. Then we get our first set of vital signs. That first set of vital signs say that, okay, we're good to begin. We're going to make sure that we have a patent IV line, and that IV line should be a 20 gauge needle or less, so it could be 18 gauge, 19 gauge, but you're going to check that before you actually even get the blood, so you're not wasting any time. So you can do a flush, you can actually hang the normal saline prior to getting the blood. So again, you're not wasting any time, because once you get that blood, it's only good for 4 hours after it leaves the blood bank. Okay, remember that. All right, you're also going to make sure you have the right IV tubing, because the correct IV tubing has a filter in it. So let me take a look at this. All right, so this is your blood transfusion tubing. If you take a look here, it's a Y connector, right? So this forms like a Y. You also can tell that in the chamber here, it's a filter here. This is not a part of a normal IV set. And so that way you know you have the right IV tubing. You're also going to want to have pump. Okay, if at all possible, have a pump. All right, and again, we're only going to infuse it with normal saline, which is 0.9% sodium chloride. Only thing that we infuse blood with. So we have that all set up. IV line is working. We start that blood. We start it very slowly. We're going to stay with that patient for at least the first 15 minutes to make sure that there's no type of adverse reaction to the blood infusion. Depending on where you work, you'll make sure you know the policy. It might be 15 minutes times 2 or 15 minutes times 4, but it's definitely the first 15 minutes, and then it's every hour afterwards. Now, many times the question is, can you delegate vital signs to the unlicensed assistant personnel? You can, but the truth is you really should assess your patient every hour to make sure nothing is going on, because sometimes the adverse response can be something like back pain that could indicate that, the kidneys are not liking this transfusion. It doesn't always have to be a febrile response, all right? And so an hourly assessment really should be done. Okay, so there are different types of reactions. You can have an acute hemolytic reaction where that blood is just not compatible. You can have a febrile reaction, which is typically something that we see, an allergic reaction, circulatory overload, and a septic reaction. with any reaction, regardless of what it is, your first priority is to stop the transfusion. Don't keep infusing that. Stop it. Get yourself a bag of normal saline. Don't use that saline that's connected to the blood, because what's going to happen is the blood that's remaining in the tube is going to be continuing going through that person's vein, and that makes no sense. So stop the transfusion. Cut your blood off. You're going to make sure that that blood goes back to the blood bank so that they can do the necessary analysis and evaluation as to what actually happened with the incompatibility of that. You're going to stay with your patient, make sure that your patient knows that everything is going to be okay. If they need oxygen, and give them oxygen. So the doctor, of course, will be alerted, and you will follow those next steps. But very important that that blood goes back to the blood bank, that you stay with your patient, you're monitoring your patient closely until all of the acute symptoms have been resolved. So I hope that helps with blood transfusions. If you have any questions, leave them down below. If you like this video, thumbs up, share, and I'll see you next video. Bye for now.